A patient comes to me and says, "Doctor, I think I have low testosterone. Some days I feel exhausted, low sex drive, no motivation. But then 2 days later, I feel almost normal again." Another doctor already told him it might be low testosterone. But when I hear that pattern, I'm not convinced. So here is a real question. If your symptoms come and go, is it truly low testosterone or is it stress and poor sleep? And at the end, I will show you exactly how I decide this in clinic. My name is Dr. Slava Fuzayloff. I'm board certified internal medicine physician, and I focus on men's hormone health. Today, we're not talking about medication. We're not talking about lab numbers. We are talking about pattern, because how symptoms behave over time often tell us more than any blood test. When testosterone is truly low, symptoms are usually steady. Low sex drive most days, morning erection consistently weaker or absent, energy stays lower, motivation does not suddenly bounce back for one good day and then crash again. It feels like a new normal. Hormone level usually change slowly. They don't swing dramatically from Monday to Wednesday. Why does this matter for you? Because when symptoms are steady and stay the same week after week, that pattern fits low testosterone more closely. When I decide to start treatment, I usually see stability, not constant ups and downs. Now let's look at the opposite pattern. Stress and poor sleep creates ups and downs. One day bad, next day better, worse after a heavy week, better after good rest. Your body reacts quickly to stress. It reacts quickly to lack of sleep. Testosterone level usually do not move that fast. Why does this matter for you? Because when symptoms clearly move with stress and sleep, that often tells me the body is under pressure, not permanently low on testosterone. When I decide to wait, it's often because symptoms clearly change with rest and recovery. Let's make this practical. Brutal week, deadlines, 5 hours of sleep, arguments, sex drive drops, mood drops, gym performance drops. Then the weekend comes. 8 hours of sleep, you relax, you disconnect, and you feel better. Testosterone does not fix itself in 48 hours. Rest can. Why does this matter for you? Because if good sleep quickly improves your symptoms, I slow down before labeling it low testosterone. When I decide not to start treatment, it's often because improvement follows rest. Morning erection are one of the clearest clues. If they disappear for months and stay absent no matter how well you sleep or how low your stress is, that points us more toward low testosterone. If they come back after good sleep and disappear after bad sleep, that points me toward stress and recovery. Why does this matter for you? Because consistently versus fluctuation guides the decision. When I decide to repeat testing, it's because the pattern is not stable yet and I need more time to observe. When I become more concerned, it's when symptoms are steady, gradually getting worse and not improving even after good rest. Low testosterone usually creates steady symptoms. Stress and poor sleep creates changing symptoms. If your symptoms move up and down quickly, improve with rest, worsen with overload, That means your body is reacting to pressure, not that it permanently lacks testosterone. That is the main idea. Your symptoms are real, but fluctuation is often a good sign. It means your system can recover, and that helps us avoid unnecessary medication. In my practice, I look at pattern first. Steady and persistent leans toward low testosterone. Changing and stress-related leans toward sleep and stress issues. Pattern first, number second. If this way of thinking helps you understand your symptoms more clearly, like us and subscribe to our channel. I will continue explaining how to separate true hormone problems from patterns that only look similar but are not.